Woo, got some volume here. Awesome. All right. Well, thank you for your patience with me today. I'm just going to mute folks. Actually, I'm going to pin myself. Okay. All right. We should be good to go. So this is quite a hot topic here. You guys know this, but a lot of people are really interested in understanding dizziness. And as I was going through the material, I found it to be actually fascinating too. And so when we talk about dizziness, there's, I think we all have an idea of what dizziness is, but dizziness covers an umbrella of symptoms, and understanding where it comes from and how you can really address it in a natural way, I think can be really beneficial. Because when you look at the stats, they say that over 70% of people will experience an episode of dizziness in their lifetime. In fact, it's the second most common complaint heard in doctors' offices, the first being low back pain. And headaches tend to follow that pretty closely too, which chiropractic does well with all of those things. And then balance disorders, which balance does fall into dizziness. That is the #1 complaint in people who are over 70. And if you know anything, in our older population, we find that if there is a fall and you break a hip, that is really a downward spiral of health from there. And so when we're looking at our health as we age, is if we can retain movement and balance and flexibility, and you're sure-footed on your feet, then the likelihood of you being healthier as you age goes up significantly. But I like to think about dizziness in terms of, or balance in terms of what it says about what's going on with the brain and all of the processors or sensors in our head. So let's get going here. Move forward. There we go. Okay, so understanding the anatomy and physiology of what's called your vestibular system. Your vestibular system is your sensory system, which provides the brain with a sense of balance and spatial orientation for the purpose of coordinating movement and balance. And when you're thinking of your vestibular system, I want you to think about the sensors and the processors. Okay, and you've got multiple components that make up those sensors and processors. Okay, and if you think about it in terms of your car, right, you've got programs in your car that censor if the air pressure is low, right, and it tells the program, hey, air pressure is low, get it checked out. Same thing with the vestibular system. You have sensors within your vestibular system that tells the brain that something's going on. Okay, so what are the primary sensors? We've got our muscles and joints. So within the muscles and joints are these neuron fibers that make up our proprioceptors. Okay, and our proprioceptors are just fancy neurons, well, fancy words for neurons that tell us where our body is in space, our spatial awareness, right? So we oftentimes call proprioception our sixth sense. And I talk about, the brain uses sensory input to process our world, right? Visual input is big, movement is big, what we hear, what we taste, how we touch. Well, proprioception is a sixth sense, right? So I can close my eyes, I can put my hand behind my back and know, well, my hand's behind my back, not because I see it or feel it or taste it, but I just know. And that is proprioception. And the highest number of proprioceptive cells are in your feet and in your upper cervical spine. Every joint of your body. We see ankles, knees, hips, tons to the spine, but especially we see upper cervical spine. And that'll be important with understanding dizziness. So you've got your muscles and joints. And that's a big thing too. If we just go back to proprioception, when you close your eyes, right, that's where your brain's really relying on your proprioception, your muscles and joints. And so because we put so much emphasis on an input on visual stimulus, when you close your eyes and you try and walk around or walk heel toe or, balance on one foot, you start to see, oh, there's maybe some compensatory factors taking place or stress on that proprioceptive system with how it's feeding the brain, where we're relying on other types of components there. Does that make sense? Okay, so we've got muscles and joints are a big sensor to our brain and how we're processing our world. Then we've also got the inner ear. So the purpose of the inner ear is to tell our brain where the body's head is in space. Okay, and so it consists of two main sensors. One is the canal, and the other is the otoliths. Now let me see. I'm going to pop ahead here. Can you guys see that very well? Oh man, that's still up there. I'm sorry. You're still seeing that up there. But I just want you to see this. So your canals, those are these things here. These things here. Okay. If you're seeing my, you guys don't see it, but if you guys see my cursor here, it's those circular or semicircular canals. So those are tube-like structures that are filled with honey-like fluid. And so when your head turns, that fluid moves in the canal, which presses on a circular structure called the cupula. You don't need to worry about that. And these sensory nerve fibers at the base of that cupula push on that cupula and send signals to the brain. So I just said a lot of words there, but basically what I want you to know is each semicircle is meant to give your brain understanding with when you're going into rotation, when you're going into flexion and extension, when you're going into, well, lateral flexion as well. So it hits all the rotary movements of the head so that your brain can calibrate that movement. Okay, really important. So the otoliths, those are these things right here. You think about the otoliths as like a block of jelly. So if you go from these semicircles down, I'm looking at this forefront in the picture, you see this block here and you see those little capsules on top of the block there. That capsule is the otolith. And that's like a gel material with these pebbles sitting on top of that gel material. Okay. And so the purpose of these are to tell the brain if the head is moving straight forward, like think about driving in a car, or moving upwards. So think about getting in an elevator or an escalator, right? So first you have the canals, which tell your brain if you're moving in space in these directions, and then if you're moving in space in these directions or forward or backwards, okay? So again, a lot of dynamic movement that's happening that's all taking place in this vestibular system of how your sensory system is allowing the brain to process where you are in space. Okay, make sense? Now, let's go back here. So we've got muscles and joints, major sensory input into the brain, how the brain processes. You have your inner ear made up those canals and those otoliths, and then you've got your eyes, which your eyes are a big visual input. So the first component where your eyes play a role is to make sure that what you're feeling and experiencing in your body is what makes sense, right? So if my arm is up here and I'm waving, I can see that. I'm like, oh yeah, that makes sense. That's what's actually happening in my body. Okay. The second one is a reflex. Okay. And this reflex is called your vestibular ocular reflex. But it supports your eyes to move in an equal and opposite amount. So if you put your thumb here, right, and you follow this thumb, that, whether you here, right, your eyes are actually moving, or being able to maintain, where a point in space as your head moves. Okay, so just because your head's moving doesn't mean your eyes have to go that way. Your eyes can move while your head's moving. Does that make sense? So as you slowly turn your head right, keeping your eyes on your thumb, your eyes stay on the thumb due to this reflex. and it signals your inner ear to send the brain, say, hey, the head is rotating to the right. So head is rotating to the right. Think about this as your eyes as a suspension system. Okay, kind of like your car has a suspension system to keep that rider comfortable and level. This is eyes are your suspension system to keep you comfortable and level. Okay. So when you have dizziness, it means that you can have stress. I don't know why it's, oh, I'm jumping around here. I guess I missed all that information. But when you have dizziness, or if dizziness occurs, it means that there is dysfunction in one of these 4 sensors and processors. Okay. And this is where I love to talk about defining dizziness, because I think all of us maybe consider dizziness in one aspect being vertigo, like you're spinning or the room is spinning, but we actually consider dizziness as an umbrella of symptoms, starting with vertigo. Okay, the sensation that the world or the person is spinning in circles. Okay, that's a dizziness component. There's imbalance, the sensation that the person is falling or simply unstable in their feet. That's an umbrella or a category of dizziness. Raftiness or tilting, that's a sensation that a person is rocking. Motion sickness is a part of or falls under that vestibular system, where the feeling of nausea, which is combined with lightheadedness or raftiness, okay, rocking. And then lightheadedness is a sensation that a person may pass out. They have a feeling of disconnect between their conscious awareness and their physical body. So all of these symptoms are categorized under dizziness. So let's go into more of each of these, because I think it'll make sense. Once we understand the inner ear and how those canals play a role with handling rotary movement, and then how these otoliths, handle movement this way or movement this way. If we have, it feels like the room is spinning or we're spinning, it's typically an indicator that there's something going on in the inner ear. Makes sense? So the problem could be with the canals, could be with the nerve that goes to that canal, could be, that connects the canals to the brainstem. So the nerve from the brain stem to the canal, or it could be a problem with the brainstem or even with the brain. And typically when we have faulty signals, we look at, okay, is there a structural component? Is there a physical stress to the inner ear? Is there an inflammatory stress to the inner ear, or is there a vascular stress? Okay. So again, you think about vertigo, faulty signals between the sensor, which is the inner ear, and the brain, because things are spinning. So you feel like body is moving, those canals or those otoliths aren't getting appropriate information to the brain. Okay. So let's talk about inflammation first and foremost. You can have vestibular neuritis or labyrinthitis. It's 2 inflammatory conditions, typically a result of a virus. Okay, so you could have a viral component that causes dizziness. Okay, there's also a vascular component, which is a pretty small percentage. It's like 1 to 3% that is vascular in nature, and oftentimes an indicator that there's a stroke taking place. Again, small percentage, but it could happen. Anytime there's somebody experiencing a vertigo attack without a previous known cause, it's just good to get checked out by a medical professional. Oftentimes, if there's a stroke involved or vascular type event taking place, there's other symptomatology that we can identify. By and large, the most common cause of vertigo is structural. And if anyone's ever heard of crystals in the ears, right? Like, oh yeah, I've heard of crystals in the ears. It's like benign paroxysmal positional vertigo, right? They're like, we want you to go through some specific movements to reset those crystals. What's happening, let's go back to this picture here. Small picture that I have is, go back to these otoliths. Remember those, that gel right here? these are the crystals up here. So that means that these crystals or these pebbles have actually shaken loose of that gel, and they're finding their way into an area where they shouldn't be. And so when they have you, there's a Dix Hallpike maneuver where they have you laid like this, and then they sit up, and then you lay like this, or we're taught to do a specific maneuver to help reorient those crystals. That's typically what's happening here, is that jello-like, block of the otolith. Those pebbles are, no longer being held in that jello. Make sense? The jello, and they fall into the canal. And so this is the most common cause of dizziness. Other things are, if you've heard of Meniere's disease, or Meniere's disease, condition where too much endolymph dumps into the inner ear canal, which is too much fluid in the ear. That could be a component too. Again, you go back to, if you have, let's go back here. If you have a problem with the canal specifically, or if you look at the nerve that goes to the canal, that's where we look at upper cervical spine. A lot of times we find if there's subluxation within the upper cervical spine, those C1, C2 that are impacting that end organ, that could be contributing to a dizziness component. And again, if we have brainstem, or the brain, how the brain is processing, that's a much bigger component of really assessing multiple components in terms of how you're moving, how you're carrying yourself. There's layers of things when it comes to the brain, but there's a way or a hierarchy in which we really assess dizziness and vertigo and understanding what it is exactly you're experiencing. Make sense? Okay. Next, so we've got lightheadedness. Lightheadedness, again, is most of the time blood flow is not getting to the brain, right? So you feel faint. So oftentimes it can be a blood-related disorder. Sensation that a person might pass out, feel disconnect between conscious awareness and their physical body. So there could be a blood-related component, generally a pretty small percentage of people. This other one is called dysautonomia, and this is where your nervous system is control of blood flow. And so if you have dysautonomia, that means that it's the communication between the brain and the body is disorganized, it's chaotic. And so the brain's not quite understanding where appropriate blood flow needs to go. And so it's not constricting, or it's not dilating. As you sit up, you don't have dilation of blood vessels to get blood to the brain. And so again, when you experience lightheadedness, it's okay, what's going on with the nervous system, the brain, how it's processing, and how can we bring organization to that messaging. So a lot of times we go to the spine, because if there's a subluxation component, that can contribute to it. Imbalance, so the sensation that a person may fall or is simply unstable in their feet. So this is one of the coolest things I typically see when people start getting adjusted, is we notice improvement in balance. I remember very distinctly, one of my oldest patients that I've seen in practice was around, let's see, was she 92? And depending on somebody's gait and how they're walking, sometimes I will videotape their walk. And I had her walk down and back in the office, and I mean, very wobbly, very unsure of her footing, weakness in how she was moving. And I mean, 10 adjustments, 3 times a week. I think I saw her for 3 or 4 weeks. I videotaped, I should find this, because this would be good data. I videotaped her walk again, and her gait was smooth, very sure-footed, moving much quicker. That's one of the first things we see when people get adjusted. So you're getting appropriate input into your joints, but that's feeding the brain good information So the brain's starting to move better. You target those proprioceptive cells that are gathering information in terms of spatial awareness. You know, your brain's really much more aware of how your body's moving, where it is in space. So typically we see imbalances. Yes, it could be a weak muscle component, but the bigger concern or the bigger issue is how is the brain processing on information? And how is that muscle joint component, how's that proprioception, that sixth sense, able to interpret information? Of course, you could have a brain problem related to, you know, neurological condition like MS or Parkinson's. So that could be also contributing to imbalance showing up in the body. If we look at that raftiness or tilting, which is that sensation of a person rocking back or forth or being pulled to one side or the other, again, I think when you understand the vestibular system, you start to see, oh, I mean, if they're moving, right, or rocking, okay, there's something going on with the inner ear and how those connect. I mean, if there's any stress to those canals, which control this, right? So if you're not moving, but you feel like things are moving, right? Or you're moving back and forth, that's what's going on with that inner ear, those canals, or potentially what's going on with those otoliths that are in charge of moving, you know, keeping you this way. Makes sense? And then we go back to also that muscle joint component of the proprioceptors. And then the last one, motion sickness. I didn't even write anything on here, but the feeling of being nauseous combined with feeling lightheadedness or movement. Again, if you're, you know, in one place and feeling nauseous, or you're driving down the road. I mean, typically when people feel motion sickness, they've been on a ship, right? They've been in a car that's introducing movement. And if you have any type of sensors that are not able to process appropriately your movement this way or your movement this way, and you are moving, and that causes stress to how your sensors feed the brain, then you have motion sickness, right? It's almost, I feel like I've really simplified dizziness here, which is a good thing. But there can be sometimes, you know, multiple components of, you know, somebody experiencing all of these things. The biggest thing is when you look at dizziness, it's number one, understanding where is it coming from. Typically, for by and large, most people, it's structural in nature. So it's identifying if you are an exception, but where is the structural component, the structural stress showing up, or where's the challenge there? And if it is inner ear, or if it is, you know, brain and how it processes, or it is the, you know, eyes and how the eyes are gathering information, there's ways we can assess that through a chiropractic lens. Most people do very well with adjustments in chiropractic care when it comes to the dizziness component. So, and a lot of time, I mean, honestly, I don't even know what, if we look at our medical colleagues, I don't know what our counterparts have in terms of how to address this, right? I mean, yes, if there is a component of vertigo that's coming from a viral stress or an inflammatory process, right? Yes, the medical realm is well equipped to address this. It's just being able to identify that, right? But if there is a structural component and we're trying to do medications and things to address that and balance things out, how well do you do with that, right? And so it's really understanding where is it coming from and how can you address it appropriately. And generally, doing it in a very natural way, having the appropriate assessment, doing it in a very natural way can be really profound, right? Help your body heal. So I guess I'll just end here, because anytime we talk about something that is condition-based, right? We're always looking for, what do I do? What's the fix, right? Because we are very much a society that likes instant gratification and to feel better, By the time, I don't know, when you look at some of these components here, yes, you can have dizziness that shows up when you're talking about an inner ear type thing. But generally, you look at the state of person, and there's been stress to a system for a very long time. And something shows up, and the next thing, if it's not addressed appropriately. And so we like these condition-based topics, but I always look at, why is it there? Are you curious about what is you're experiencing in your body? That's the biggest question. And not to go to what can I do to fix it, but why is it there? What's been going on? How's life been? Has there been more stress? Am I having trouble processing things because the demand goes up and I am unable to appropriately process that demand? It's just really sitting with your body. And then I love people who are getting chiropractic care, and especially in our office, because you are more informed, right? You guys are showing up on Tuesday night to a workshop. Some of you guys show up every Tuesday night here in Zoom, which we love, and really becoming a more informed consumer in your healthcare practices, but also in how you choose to take care of your body. And so where am I going with this? It's when there's a condition-based component, I think it's always worth being curious first and foremost, and then looking at, what are my options in terms of really addressing it in the spectrum. And the beauty of chiropractic is that when you are under chiropractic care, you just already are in and taking a natural approach to assessing your body and your health, right? If you need to take that next step, you can, and it's there for you. But oftentimes we start with, the firefighters first, the guys who are going in because it's an emergency situation. So I'll end with this. We are doing a patient appreciation week, the 4th week of August, so the 22nd to the 25th. And this is where we give back to our community and the people who are coming in to see us. Because we know that if people are getting their spines checked and understanding the importance of their spine and their brain and the nervous system, that they are generally healthier, or at least they have the opportunity to make a healthier choice as it relates to their body. And so that week we do exams and x-rays at our expense fully. We only do this 3 times a year. And so if you have anybody in your life who you want to refer in, this is the week to do it. Because we really want to make sure that the people that you love and care about, are also able to make healthy choices along with you. So when you have your accountability buddy, who is your spouse or your best friend, or your colleague that you see on a regular basis, you tend to make better health decisions together. So appreciate that you are here with us today. I'm going to go ahead and stop the recording, and then if you guys have questions, you can certainly ask them. So